Are you turning 65 and just don't know which direction to go, whether that's the Medicare Supplement route or a Medicare Advantage, otherwise known as a Part C plan? Well, in today's video, I'm going to take a few minutes and go over this with you, so you want to watch it in its entirety. By the way, my name is Rob. I am with Agape Insurance and Financial Group in North Mississippi. Some know me as the Medicare Minister, and today I'm just going to give you a brief overview and hopefully some clarity and some direction on which route to go, because by now you're getting bombarded with phone calls, you're probably getting tons of mail, you're getting emails, you just got people coming from all directions telling you, you need to go this route, you need to go that route. And once again, today I pray that I can bring you some clarity to this whole Medicare process. So by now, if you haven't, but maybe you're close to 65 within 90 days, you should have gotten your Medicare card. If you haven't, don't fret, you'll probably get it any day now. But if you don't know if you're supposed to apply for Medicare, then you'll definitely want to watch one of our other videos to see if you need to apply or if you automatically will go on Medicare. So first, let's talk about Part A just real briefly. Part A for most people is not going to cost anything at all. It's going to be a premium free or a zero premium if you have a qualifying work history. Once again, you can watch one of our other videos that will explain this more in detail. If you do not qualify with the work history, then you could pay up to $506 per month. Once again, I would say in my experience, 90 to 95% of people qualify under the zero premium Part A plan. And you can see there the deductible that's associated with it is $1,600 for each benefit period, which just means I could pay that multiple times depending on the gap between the lengths of stay in the hospital. Part B, the premium for 2023 is $164.90. If you make a higher income than that, then you could pay a higher premium. And I sound like a broken record, but once again, we have other videos on that you're more than welcome to watch, where we dive a little bit deeper. But most people, once again, in my experience, 90 to 95% of people are going to fall in that $164.90 category. There's also a $226 Part B deductible. That's this year's Part B deductible. That's an annual deductible. And then you're responsible for the 20% that's left over that Part B doesn't cover. Okay, so this is one of the reasons you need to look at which direction you want to go, whether that's the Medicare Supplement, also known as Medigap, or the Medicare Advantage route. All right, so let's talk about a Medicare Supplement. Okay, so what is a Medicare Supplement plan or Medigap plan? It's real simple. Medicare Supplement Insurance, or Medigap, is an extra insurance you can buy from private health insurance companies to help pay your share of the your share of out-of-pocket costs in original Medicare. You must have original Medicare, both Part A, that's your hospital insurance, and Part B, your medical insurance, to get a Medigap policy. This is straight from CMS.gov. So to keep it real simple, this 20% that's left over that you see here on the screen, here where it says Part B deductible and co-insurance, that 20%, if you did not have a Medicare Supplement plan or a Medigap plan, that 20% is uncapped, it's unlimited. This is one of the biggest reasons that you want to have a supplement plan in place to shield you against this. It's also going to cover that $1,600 deductible if you were to go inpatient. The only thing that it will not cover is the Part B deductible, and that is only if you do not qualify for a Plan F. F is what I call the Cadillac plan, and if you qualify for Medicare on January the 1st, 2020, going forward, you can no longer get a Plan F. So the Medicare Supplement Insurance or the Medigap plan is going to help you with these out-of-pocket costs. And the most popular plan nowadays is the Medicare Supplement Plan G. That is what I would call the new Cadillac plan. And I'm not going to get lost in the weeds on that either. I have other videos for that, but that's just the most popular. And listen, time out real quickly. Just because it's the most popular, that doesn't necessarily mean it's the best situation for your needs. And that's why you definitely want to reach out to someone like us or another seasoned advisor that maybe you trust or you know, just to make sure that you get on the right plan for your needs. You can call us at any time. The number's on the screen, and if it's not on the screen, it will be down in the video description. We work not only in North Mississippi, but in pretty much every state. And if we're not in your state, we have a trusted network of seasoned advisors that we can connect you with to make sure you get pointed in the right direction. All right, so if I'm gonna stay on original Medicare, that's my red, white, and blue card, then I'm going to need to get a Medigap or Medicare Supplement policy. And I'm also going to need to get a Medicare Part D plan. What is a Medicare Part D plan? It's simply the prescription drug benefit portion, right? And it's the part that Medicare that covers most outpatient prescription drugs. I highlighted the word most because in a perfect world, it would cover everything really, really well. Unfortunately, it doesn't. So once again, this is why you want to get with a Medicare advisor who knows what they're doing, because getting this one area wrong could cost you hundreds, even thousands of dollars every year. Part D is offered through private companies, either as a standalone plan for those enrolled in original Medicare, that's what we're talking about now, or as a set of benefits included with your Medicare Advantage plan, which I'm getting ready to talk about here in just a moment. So if I'm going to stay on original Medicare, the two plans, the nuts and bolts that you got to have here is going to be the Medicare Supplement and is going to be the Medicare Part D. Real quickly, there are other things that Medicare doesn't cover. I call those the gaps in Medicare, but you can get plans that will fill those gaps. Like Medicare doesn't cover dental, vision, and hearing. It doesn't cover long-term care plan and more. The good news is we have plans that we can put you in that will help shield you against those costs. All right, so that was option number one. Option number two is the Medicare Advantage plan route, or Part C. So what is a Medicare Advantage plan? I took this straight from cms.gov. And it says you can get your Medicare benefits through original Medicare or a Medicare Advantage plan like an HMO or PPO. I'm going to talk about that here in just a second. If you have original Medicare, the government pays for your Medicare benefits when you get them. If you go on a Medicare Advantage plan, sometimes called a Part C or MA plan, they are offered by private companies approved by Medicare. Medicare pays these companies to cover your Medicare benefits. If you join a Medicare Advantage plan, the carrier will provide all your Medicare Part A hospital insurance and Part B medical insurance coverage. This is different. I'm going to highlight this here. This is different than Medicare Supplement insurance or Medigap policy. Okay, so once again, now that carrier, that plan takes over, where if you stay on original Medicare is in charge. So the two most common types of Medicare Advantage plans are what they call an HMO and a PPO. Short version, an HMO says I can only go in their network of doctors, providers, or hospitals unless it's an urgent or emergency situation. So it's very, very restrictive. The second option here, most popular plans, are the PPO plans. This is what we recommend if this is the route that you have to go or you need to go for your particular needs. And it simply means that I can go in and out of the network, but I pay a higher out-of-pocket cost if I go out of the network. Okay, so you're usually going to pay more if you do not stay in their preferred provider organization. So these are the two most common types of Medicare Advantage plans. Now, here's something I really need you to focus on, and that is Medicare Advantage concerns. I put some of the top ones here. Number one is their restrictive networks of doctors and hospitals, especially if you're on an HMO plan. If you're on an HMO plan or looking at an HMO plan, you really want to reconsider if there's another option available there, because the PPO is going to be less restrictive. Max out of pocket yearly cost. This is a big one. Where I live in North Mississippi, the max out of pocket average is about $6,000, which just means if I go ring up $50,000 in medical bills this year, the most I can be responsible for is that max out of pocket that is set by that plan. In this case, here where I live, it's $6,000. So that's better than paying $50,000. And if I just stayed on original Medicare and did not get a supplement or a Medicare Advantage plan, I'm responsible for 20% of that, which is $10,000. So it's a lot better to pay $6,000 than it would be $10,000. And if you don't have anything at all, that 20% is uncapped, it's unlimited. The other thing we want to be concerned about here is you're not in control. Just like I read a few seconds ago, the health plan is in control. That's why that's called managed healthcare. They're in charge. And so that leads me to the last thing here is prior authorizations. Many services that you need to get done on these plans have to go through what's called a prior authorization. So it's a little bit more red tape that you have to go through. And many times we hear beneficiaries get frustrated by this because it's not something, in most cases, it's something they really need. Okay, so these are just some concerns that you have to be aware of. And real quickly, before I get into the last thing, if you are getting value from this video, we would love it if you would comment below, click the like button, turn on the notifications, and subscribe to our channel. And then share this with someone who may be turning 65 and going new to Medicare, that needs to hear the value that we're providing in this video. This just helps us help more people because it makes it easier for people to find us. So let's wrap this video up today. And the last thing I'm going to share with you about Medicare Advantage plans is, even though there's max out of pocket yearly cost, there's co-pays built into the plan, I want to finish with just making you aware that you can shield yourself against some of those concerns when it comes to max out of pockets and when it comes to co-pays. And I've written here, hospital indemnity plans pay your out-of-pocket costs that the Medicare Advantage plan leaves you with, such as daily hospital co-pays. Right? If I'm to go inpatient in the hospital here in North Mississippi, it's about $300 a day for the first 7 days that I'm responsible for if I was on one of these Medicare Advantage Part C plans. There's outpatient surgery copays, there's ER visit copays, there's ambulance rides copays. So you can put a plan in place. Hospital indemnity is the Medicare or the insurance needs terminology. But to make it real simple, it's just a little gap plan that you can put in place. So if you're turning 65 and don't know which route to go, I pray this video has given you a little bit more clarity. But I would simply advise you to reach out to myself, to one of my agents. That's my wife and I on the screen here at Agape. The number should be somewhere on the screen. If not, it's down in the video description. And so we'd be more than happy to work for you. And if we do not work in your state, we have a network of people that we work with all across the country that we can help you plug into. So once again, I pray that you got some value out of this video today. God bless you guys, and we'll see you on the next video.